Thanks, Steve, and welcome everyone. We're really delighted to be able to bring this webinar to you all today. And I'll just quickly tell you a little bit about COVID-N and the engaging work group. So next slide. So COVID-N, if you're not aware, was a time-limited network that was brought together right at the very beginning of COVID in April 2020. That seems like a long time ago now, although it's gone by really quickly. And it was really bringing together those who are supporting decision-making around COVID-19 to talk about best practices for finding and using the best available scientific evidence as it was emerging back then. And it was also an attempt to reduce or avoid duplication and research waste. And so, as we know, many jumped into this space and were working on evidence syntheses, generating new evidence on a daily basis. And it was really an attempt to try to make others aware of what was already going on, and perhaps even more produce some more collaboration so groups could work together on reviews as opposed to individually. There are more than 50 partners included in COVID-N all around the world that met those criteria that have come together, and it covers the full spectrum of public health or pandemic responses, including public health measures, clinical management, health systems arrangements, and economic and social responses, as well as members from both high income and low and middle income countries. Next slide, Steve. And this just shows you here, if you were to go to the website, which there is a website, these are just the logos of the partners. And next slide. And then there's lots of different ways to find out more about COVID-N. So we were just showing you there the logos on the website, but here is the URL to the website. There is an inventory of best evidence syntheses for those 4 areas: the public health measures, clinical management, the health systems arrangement, and economic and social responses. There's also horizon scans for emerging issues that you would find there. And then for those that are in the community who are supporting decision making, there is the sustained by the engaging working group. We also have a listserv that actually has over 350 members on it. As well, we've organized webinars on a monthly basis to talk about different issues related to either evidence syntheses practices or make folks aware of different resources. And there's a living hub of COVID-19 knowledge hubs. There's also an email, and also very active on Twitter. Next slide. I think that's the end. And just in terms of the acknowledgements, COVID-N has been funded in a variety of ways through initially the government of Ontario through an existing grant that Dr. John Lavis and Dr. Jeremy Grimshaw held at the time COVID started. There's also the support and exchange that known as RISE. It was also funded by the National Institutes of Health Research, the Evidence Synthesis Program in the UK. Individual donors also provided funding, as well as the Canadian Institutes of Health Research. So thanks very much, and looking forward to a fantastic webinar today.
Thank you, Maureen. I'll just share my screen. Can you see my screen?
Yes, it's just not in presentation mode.
Okay. There we go. Is that clear now?
Perfect.
Great, thank you. So thanks very much, Maureen and Steve. My name's Ruth McQuillan, and I work at the University of Edinburgh. I co-lead something called Uncover, which is the USHA network for COVID-19 evidence reviews. And along with Jorge Barreto, my colleague, who is also here, who's from the Oswaldo Cruz Foundation in Brazil, we co-chair a group within COVID-N called the Prioritizing Group. So just to give you a bit of context and background, Maureen's covered most of this already with that introduction to COVID end. So the horizon scanning panel that Maureen mentioned just now, this is an international panel of citizens, service providers, policymakers, and researchers that was set up quite early on in the pandemic and has met regularly throughout the pandemic. And the task that they have undertaken is really to prioritize topics that for evidence synthesis. So to identify priority topics where good quality evidence synthesis is really urgently required to support decision making. So this is a very diverse panel, both in terms of the roles and in terms of where in the world the panel members come from. So it's a really, really truly global attempt to identify priorities. So the prioritizing working group that Georgie and I have been working with was set up in February this year, and it's a short life working group. And our task has been to take the output from the horizon scanning panel and to turn that into something that we hope researchers and funders will really engage with and really adopt as priorities for undertaking evidence synthesis. So I'm going to speak a bit about how we've done that and what the results of that process have been. So this is the process that we've been going through since February. So the first thing we did was the output from the horizon scanning panel is really in terms of quite detailed descriptions of topics. So the first thing we did was to break those descriptions down into a series of research questions. So that was the first task. We then wanted to make sure that we weren't encouraging duplication of effort. So we had a look to see what work had already been done on these questions. In parallel with this work, there's another part of COVID end called the Citizen Partnership Task Force, which is led by Maureen Smith and colleagues, and their role is to promote active citizen engagement in evidence synthesis. So they've been doing lots of work alongside the work that the other parts of COVID end have been doing. And they've developed some resources to support research teams in engaging effectively with citizens throughout the process of planning and undertaking evidence synthesis. And then the final stage of the process is engagement with researchers and funders to try and encourage people to take up the priorities that have been identified through this process. So that's really what this is all about today. So just to say a quick a little bit more about the work of Maureen Smith and FP Gauvin. They have produced a number of excellent resources. So there's a guide for researchers, there's some training materials for researchers and for citizens, and there's a specific tool for researchers to use to plan citizen engagement. So this is all available on the COVID end website, and it's really excellent and helpful to anybody in this position. So it's good to have a look at that. So to look at the results of the horizon scanning panel, I said they'd met regularly. So they started the first meeting was in July 2020 and the last meeting was in July 2021. And they met 10 times between those two dates. So approximately once a month. And the way that they have tackled this work is to prioritize topics within 5 themes. And I think Maureen mentioned these 5 themes earlier. So we call within COVID end, they're known as it's what we refer to as the COVID end taxonomy. So public health issues related to COVID, clinical management issues, health system issues, social and economic issues, and cross-cutting, more interdisciplinary issues. So the panel has identified 40 topics. And each month those topics are reviewed. Sometimes the order is changed, sometimes new topics are added in, sometimes the topic is refined a little bit. So the final list, it has 40 topics, 5 public health topics, 5 clinical management topics, 8 health system topics, 13 economic and social topics, and 8 cross-cutting topics. And as you would expect, those topics evolved, those priorities evolved over the period of the time that the panel was looking at them. So initially, there was obviously a really big focus on sort of emergency or very operational, urgent public health, clinical management, and health system issues. But over time, many of those questions were addressed and answered, and the focus has shifted much more to the long-term implications of the pandemic, to issues of equity, to economic and social issues, to quite complex cross-cutting policy type issues. So, and in parallel with that, there's been a sort of evolution in the complexity. So a lot of the initial questions were quite straightforward, whereas they've got increasingly more complex as we've kind of moved through. And there's a link there to the website, so you can look at the output of the Horizon Scanning Panel in that link. So what did we do as our prioritizing group? The first thing we did was to frame these topics as research questions. Some of them were really straightforward, like this one, a very straightforward topic, maps very easily and in a very straightforward way onto a research question. But many of them were a lot more complex. So this was a question about adherence to public health measures. And as you can see, we broke that down into 3 distinct questions. So some of this complexity is because there may be, 3 different topics all rolled up into one priority. Sometimes there's a descriptive element and an interventional element within the same topic. Sometimes the populations are very different. So we have made an attempt to try and break these questions down, and of course, these topics down. So broken each topic down into constituent questions. So of course, there's more than one way to do this. This is not a you could argue different ways of breaking these things down into topics, but we spent quite a bit of time as a group thinking about this and iterating and discussing amongst ourselves about how best to break these topics down into one or more questions. And we thought it was important to do that because a lot of the topics we found quite difficult to grasp sometimes because they were quite big and had lots of different elements to them. So we thought it was really important when engaging or trying to engage the interest of researchers to start the process of breaking these topics down into questions. And of course, it's only a start. If research groups are taking these questions on, they would obviously want to do, to refine this further and really think about this further, but we felt it was important to make a start on that process. So that's just a quick look at how the 40 topics broke down into questions. So we had 40 topics and we've broken those down into 73 questions. And you can see the distribution of questions there. So the majority now under the health system, economic and social, and cross-cutting issues. So the next thing we did was we wanted to avoid duplication, as Maureen outlined initially. Avoiding duplication is a really important aim of COVID End. There's no point in people doing the same work in parallel. So we searched in the COVID End inventory of best evidence synthesis, which is available on the COVID End website, and also on the NCC-MT repository of public health evidence syntheses. So some of Maureen's excellent students did some work on that for the group. And we also searched in Prospero for planned evidence syntheses. And this next slide just shows you how some issues are very, have garnered a lot of attention and have got a lot of work either completed or underway or planned on them. So this priority screening for and managing emergent mental health and substance use issues, including trauma for the general population and for specific population groups such as healthcare workers, and understanding the links between substance use and pandemic-related increases in domestic violence and suicide. So you can see there's a lot of different topics within that particular topic. But when we had a look within Prospero, you can see there 68 systematic review protocols on health worker mental health, 12 protocols on intimate partner violence and COVID-19, and 4 on alcohol or substance misuse and COVID-19, although not specifically linked to intimate partner violence or healthcare workers. So you can see that a lot of these topics are very well covered. It doesn't mean that absolutely every aspect of that topic is well covered. There may still be some gaps, but it's just an indication that there are some topics that are much better covered than others. So the contrast is with the second topic on the slide, which is to do with enhancing economic security by addressing pandemic-related job losses and safety nets. So that's quite a complex economic question or set of questions, and we found no relevant protocols on that. One caveat there, we were searching mainly within the public health biomedical sciences literature. So you could argue that you wouldn't expect to find much on that topic within the places we were looking. So there are caveats to this. This is not an exhaustive exercise by any means, but the overriding point is that some topics are much better covered than others. So in looking at these 73 questions that we identified from the Horizon Scanning Panel list, we looked to see which ones of those questions were covered by living evidence syntheses, which were covered by non-living evidence syntheses, and which were not covered at all in our very preliminary searches. So you can see from that list that the split was about 1/3 each. So about 1/3 of the topics are covered by living evidence syntheses, a further 1/3 by non-living evidence syntheses, and the final 1/3 not covered at all. And if you look at how those break down in terms of the COVID-19 taxonomy, you can see that the more poorly covered topics are in the health system, economic and social, and cross-cutting parts of that taxonomy. So public health and clinical management are relatively well covered compared to these more complex interdisciplinary type of issues. Quick caveat there, these things quickly become out of date, and as soon as you've completed a search, the next day something can be published. So this is all very heavily caveated, but it's just to give an indication of where attention has been focused so far compared to where the Horizon Scanning Panel has put its priorities. But in terms of the detail, all of this has to be checked in the moment if people are adopting any of these topics. So if I've put links there, and I can put them in the chat afterwards, links to those 3 lists, to the 23 questions not currently addressed by evidence synthesis, to the 24 questions addressed by non-living evidence synthesis, and to the full list of topics and questions. So I can put those in the chat afterwards. So just to finish off, sorry, that's a bit not very clear, that slide. It's a bit hard to read some of those, but I'll quickly just run through them. So there are a number of questions and dilemmas that we faced as a group. The first one that we've all faced in this pandemic is lack of time and resource. So we were meeting you know, in this kind of format from across the world, different time zones, all trying to juggle this alongside our day jobs, as everyone has been doing over the last 18 months or so. I mentioned some of these other points as we were going through. So we did things very quickly. So we haven't looked exhaustively. So we haven't necessarily looked in all the right places for the topics. So that's, you know, something that anyone who's interested in these topics would need to take on, really looking more exhaustively to check what's been done. A lot of these topics are very complex, and we had a little bit of debate within the group about whether they're too complex, whether we should just say, well, some of these topics are just too complex to tackle. But actually, I kind of feel, and I think, you know, there's a consensus within the group which feels that really it's up to us to find a way. You know, we have to find a way of addressing, if these are priorities, if these are priority topics, priority questions, we have to find a way to answer them. I mentioned before that things quickly become out of date, so as soon as you've checked something, you know, the next day it can become out of date. Some of the topics from the Horizon Scanning Panel are very detailed, and we worried a bit whether we were interpreting those correctly, but luckily we had members on our group who were on the Horizon Scanning Panel. We were able to check that out with them. And then coming back to this question of complexity, a lot of these topics need an interdisciplinary approach, which brings in people from very different research traditions, and that it brings joys, and it's fantastic to work in those days, but it's also challenging. So that's another sort of challenge of this kind of work. Although I would argue that that's one of the real exciting things about this kind of work, that you are, you know, constantly having to reevaluate the way you do things because you're challenged by different disciplinary approaches. So it's a work in progress. We and you know, I've explained some of the challenges we've faced. So we are really hopeful that you will give us some feedback, which we can incorporate into this work. We want to get it completed within the next by early December, and to have a summary up on our website. Some acknowledgements of all the fantastic team from various places who've been involved in this work. And then over to you, really, if you have any questions or suggestions or advice for us, we'd be very, very grateful for that. And I will stop sharing my screen.
Well, thanks, Ruth. Thanks for a great presentation. As I mentioned earlier, if anybody does have questions or comments or suggestions for Ruth or in general, please use the chat box to ask them, and then we will address them. I'll just give people a moment to type that in there, but I do see there's one already from Ayrton. Have you also collected priorities that are covered by the international media?
No, no, we focused entirely on the priorities identified by this Horizon Scanning Panel set up by COVID-19. That was our remit to do that. But that's a really interesting point. I mean, I'd like to hear more about that if you want to, if you're happy to elaborate a bit. That would be interesting.
Please do share Ayrton in the chat. I would guess that a lot of the or not a lot, maybe some of the priorities at least covered by the panel would have been also covered by the media, though, like stuff about return to school, or how to encourage vaccination rates and stuff like that, because it would be broader concerns. But I'm sure there's obviously some that are a little bit more specific, or maybe less media friendly that would be, covered by these by the panel and not in the press. Good. Sorry, go ahead.
Yeah, absolutely. I mean, I think, a lot of the topics are ones that you would expect, exactly the impact on children, impacts of, COVID mitigations on education. So impact of online teaching and school closure, how to address vaccine hesitancy, all sorts of, most of the topics that you would expect to see were on that list. But as well as that, there were some quite complex economic and social questions going forward.
Great, thanks. Maureen asked, she said thank you, and then asked, were you surprised that there were no living evidence syntheses on public health measures?
Yeah, I think that is a surprise. And I wonder, I mean, although I suppose in some ways I was more surprised that I thought there would be fewer living evidence syntheses. And I was actually quite impressed that there were as many as there were overall. I think that's great that people have just undertaken to do the living evidence syntheses already.
Great. While we're waiting for some other questions to come in through the chat, Jorge has also joined our panel. So I just wanted to see if you had anything that you'd like to share either from the presentation or separately.
Thanks, Stephen. Actually, I would like just to say that Ruth did a very interesting and good presentation. Congratulations, Ruth. I think that the most important thing about the experience in the prioritization work group of COVID is we have a lot of different priorities. For example, Ayrton asked us about the priorities in the international media, but in the COVID end, we have a specific group to collect the impressions and visions and actually different visions about what are these priorities in the visions of different groups. So the group of horizon scanning is very diverse and have a representative of different sectors. My feeling is we include the vision of the international media because we have journalists, we have people that work in this sector, and it's very, very hard to capture everything and to structure and adopt a systematic and transparent way to identify priorities. So our work group, Ruth and me, actually Ruth work a lot and me many times I'm in position just to learn about how we can to do that. We have another people in this group, for example, to structure the topics and the questions, and many people work to have this table that represent the state of our work. But we feel we have a need to have advances and to have next steps to do that, because the time is a very important thing if you are trying to seek the priorities in an emergency, in public health emergency scenario, as we have in the COVID-19. So for me, the most important thing is the lessons and what we learned doing this work. I feel that's very important to share with everyone. Many thanks, and over for now. Thanks.
Thank you. Thank you for sharing that. We had another comment from Ayrton, who said it's a very dynamic time for sharing information worldwide, although the topics that have been covered, it seems that are in the same line. So having said that, there is a lot of misinformation and disinformation in developed and developing countries. I know that's not strictly what the Horizon Scanning panel is addressing, but did you want to comment on sort of that issue at all, Ruth?
Yeah, I mean, I guess in the light of disinformation, all that we can do is try to provide, work harder to provide information that is trustworthy, and also think carefully about how it's disseminated. I remember quite early on in the pandemic, we did a rapid review very early on in the UK about health inequities in terms of race and ethnicity, and we provided, it was for a specific in response to a question from a government source, and so we provided this information. There was a lot of pressure on us to engage with the media about that, and I felt really strongly that wasn't what we should be doing at that point, because we'd been asked to do a piece of work very quickly, which we did, and it was for a purpose. We passed it along, and I didn't think, I think there was a lot of people rushing early on to get media coverage for things that were done quickly and had not been through the normal publication process and peer review process. So I think as researchers, we have to think very carefully about what we're doing and why we're doing it, and to be very cautious, because I think that can do a lot of harm by people rushing for media attention before things have been thoroughly checked. So yeah, I mean, that doesn't really answer your question, but I think we do need to be very careful about what we say and when we say it. I don't know if Maureen, if you have anything to add on that, because you also have been involved in this kind of activity, I guess, and it can be quite difficult sometimes.
Yeah, I mean, I would only add there that I think in terms of having a group that is sort of on standby to answer questions and then to do them extremely quickly worked, I think, in COVID, because it was all new evidence and there wasn't decades worth of evidence to synthesize. I mean, there's certainly in some topics now a fair amount of primary literature and many reviews, but in terms of thinking to the future around non-COVID topics, if something like this is to be maintained, which I mean, I hope it is, in terms of the appetite for using evidence to inform policy and other healthcare decisions and other decisions, but how to actually really operationalize that, for example, in, let's say, chronic disease prevention or treatment, where you have decades worth of research. I think it would be extremely difficult to be thinking about how to do that rigorously in really short timeframes. Not sure if that exactly answered that issue, but that's kind of where I've been thinking lately.
Thanks. We had another question / comment from Maureen as well. So with there being no syntheses on the economic questions, I wonder if that field has limited expertise in evidence synthesis versus primary research, and if there is an opportunity here to support capacity development for syntheses among academic economists. Do you have any thoughts in that regard, Ruth?
Absolutely. I think that's what we should be doing. I think we need to be reaching out and having that conversation and seeing if and really trying to, and that's quite exciting because it's a new, it's a new area. I think there's a bit of a parallel early on when people were really unsure about, it's a completely different topic, but when people early on were really unsure about the transmission of this, of this virus, we did some work with colleagues at the University of Edinburgh who had expertise in fluid mechanics. So a bunch of physicists and engineers, and it was great. It was really good because they had really no conception of evidence synthesis, and we didn't have any conception of fluid mechanics, but it was really it was a really rich and exciting learning opportunity. And, you know, I think there's great scope for that kind of, you know, well, synthesis of different approaches. And that was one of the things I'd put about one of the challenges, but also one of the real rewards of this kind of work is coming up against very different disciplines and their ways of thinking, and it, you know, it challenges you. But I think that's a really good point about the economic questions that would be really interesting to pursue.
Great, thanks. And I actually had a question for you as well. Just, I mean, not that you know, not that COVID-19 issue has been, you know, resolved and is done, but as we start to think about, you know, moving, I don't know, I mean, either, you know, living with COVID-19 or moving beyond that, is there anything from this process that you think could be applied to future issues, or, you know, whether it's the whole thing or kind of elements of it that we can learn from and build on for the future?
Yeah, I mean, I think so. One issue that's really I mean, it'll be in the news everywhere, but particularly in Scotland, because we are hosting the COP conference at the moment, is climate change. There's very, very many parallels in terms of being very cross-disciplinary, and whether we should be, you know, thinking a bit more proactively rather than waiting for the next crisis, whether we should be just gearing up to think about the impacts of climate change on health, and more broadly on society, on mitigation and adaptation, you know, both kind of aspects. I think we can transfer some of the learning into that arena. I think in terms of the reflection on the horizon scanning panel, as I was saying earlier, we were not, well, actually Georgie was involved in the horizon scanning panel. I wasn't part of that, but I think we would really, one of the things that's on our agenda is to work with the horizon scanning panel to reflect on their experiences, and to bring that all together with our bit and write that up. But we haven't quite got there yet.
No problem. I would like to apologize to Maureen Smith. She had a really good question earlier, and I missed seeing it in the chat, but she asks whether we think there's more that can be done to nudge researchers to include citizens in their reviews.
Yeah, so I mentioned earlier about the resources that Maureen has put together, which I said as well that we were hoping to finish this work within the next month. So this summary of this work within the next month. So that piece of work will be on our website, and we really, on the COVID End website, and we are really intending to foreground the values of COVID End. And one of the key values, alongside you know, avoiding duplication of effort and waste, one of the core values is citizen engagement. And the work that Maureen has done really is very practical in terms of how, as researchers, you actually go about doing that work, and in very practical terms and some practical tools. And just on I have actually completely inspired by Maureen. I have a dissertation student who's just started doing his dissertation on evidence synthesis and citizen engagement, that we are hoping to learn a lot from for our Uncover group. So I think you know, it's you know, just step by step, I guess. I mean, it'd be really interesting to hear from Maureen about what your reflections are, Maureen, and what your Maureen Smith, and what your recommendations are, really, if you're.
Great. Well, we can see if Maureen will share some stuff in the chat in a moment, but we have another question in the meantime. Just if you're aware of resources for occupational related evidence, such as workplace prevention, workplace management of COVID related symptoms, etc.
So not through this work particularly. Was it about sort of buildings and risks within buildings or mitigation measures, or it's not? I don't think it was. There's not. I don't think we had anything very much in the list of priorities. There's some other work that we're just about to get involved with within our group, but not anything specific within this sphere.
Thanks, Ruth. I've just allowed Maureen to speak as part of this, so she can share some of her thoughts from the previous discussion.
Thanks, Ruth. So yeah, I can't type fast enough. I think what worked in Canada was this personal nudge. So we had champions. So we had Jeremy Grimshaw, John Lavis, and Andrew Trico, who are highly respected in their field, who nudged their colleagues to say to try this. And so it was that personal connection that I think worked. And so I keep thinking about, how do you do that on an international context? Do you need connections in every country where the research is being done? And you need these champions? Because I really think that, and I'm sure Maureen Dobbins can comment on that. I really think it was that personal connection of, here's the resources, but it's not enough just to post them. You need someone in the background saying, you could try this. I think it's set up. I think it's set up to work. It's not going to delay your research by weeks. I think this can be done. And I think that's what happened. And like I said, I'm struggling with, how do you then take that and move that in all of the different contexts, of the work that needs to be done. So thank you, Stephen. I'll be quiet now.
Yeah, and I wonder if that's something that we should really be stressing with funders, because what I see from more generally is that when funders, start to insist, then that's when things change. So maybe that's something we need to take away. We want to do a page for researchers and a page for funders, and I think maybe that's something we need to be really stressing on the page for funders, or the engagement with funders, is that this is essential.
Thanks, Maureen. Thanks, Ruth. We've had some great questions. I don't see any more in the chat right now, but just in case there's others that are still thinking about questions or typing, I thought I'd just pass it back to Maureen Dobbins quickly, in case you have any last comments or anything you'd like to share.
Sure, thank you for that. And I mean, in regards to your comment, Maureen Smith, one of the things I would agree completely, right? Having the nudge and hearing it being talked about so much, about the importance of including patients, citizens in the rapid review process, got us thinking about something that we had not been doing. But also what was absolutely crucial was knowing that we could email you and you'd have us fill out a form, and then you did all the rest of the work to then connect us with citizens who had already been identified, who were, sort of like waiting to be asked to be involved. And the speed at which you've been able to do all of that, it really didn't hold up our review, because it's usually within a few days of contacting you, you must never sleep, because you respond all the time and almost immediately. And then we have someone identified within days, and then we kind of took it from there. And so all of that on our end was absolutely crucial. If we had had to spend the time trying to find someone to do all of that background work at the same time as trying to meet, you know, deadlines of just days to get some of these reviews done, that would have made it extremely difficult. I don't know how often we would have been able to do it. So definitely thinking about how that applies to the future going forward is, you know, a lot of thought needs to be given there. But I agree completely, Ruth, that if this becomes, and I think in Canada we might have this for some funding competitions, but if this becomes an expectation in order to be eligible to apply to a certain funding competition, then you definitely will see the researchers moving in that direction. I think it's, you know, I've used a lot the word meaningful engagement and representation of voices. There would need to be some really clear criteria in terms of what does it look like in a grant when you get that meaningful engagement, as opposed to being pretty savvy and writing something that makes it look like there's engagement, but there really isn't exactly what we're talking about here. If I can be so bold as to say it that way.
Great, thanks, Maureen. And Ruth and Georgie, do you have anything that you'd like to share?
Not from me, thanks.
No, for me, thanks, Stephen. I would like to take the opportunity just to thanks for the invitation and to hear about the questions and the thoughts of everyone. Thanks.
Great, thanks. Janine shared that they are embedding academic partners to guide evidence processes in health security implementation proposals to USAID and FCDO, and they are responding positively. So that's great to hear as well. So well, I think without any other questions, I think we'll just maybe wrap it up a few minutes early today, but I'd like to thank Ruth and Georgie and Maureen again for being part of today's webinar. We will be posting a recording from today's session on the COVIDN site and sharing it through our Twitter channels as well. So if you have colleagues that weren't able to make it today, you'll be able to share the recording with them. And we hope you join us for future webinars as well. Thanks again and have a great day.